Hi, this is Darnell Placewise coming back to you from Delta County. Earlier today, I had an opportunity to sit down with Robbie LaValle, Delta County Administrator, and Jody Rober, Delta County Memorial Hospital's Chief Clinical Officer, to give an update on Delta County's COVID-19 pandemic response. Robbie, would you like to give us an update on the county's continuous planning for COVID?
So our unified command, again, the unified command between Delta County Memorial Hospital, Delta County Health Department, and Delta County has continued to meet on a weekly basis. We do know that the cases, the COVID cases, have increased lately, especially when we look at the last 3 weeks. However, we've also increased the number that have recovered. We have recovered a significant number of the cases. I think this morning we're up to 105 that have recovered. We do know that, again, as we have additional testing, we have about 2%. It hangs around the 2% positivity rate. So again, these were all anticipated. All of the additional testing, the additional cases, the contact tracing, as well as those that have recovered, were all anticipated by Delta County. And that's where we continue to base these plans on. So as we look at our ability to contact trace, we've noticed that we do have additional spots in the area that come from groups. So that's why our continual messaging is just to limit the size of the groups to the best available possible. Now we also know that when we're outside, then there is that decreased chance of that direct contact. So again, we're not saying eliminate, we're just saying limit to the best possible, and those that are vulnerable, continue to provide for the best management there and continue to make sure that you avoid contact wherever possible and to wear the mask when it's not possible to limit that contact. But again, we want to stress that we knew that as our testing increased, that our additional cases would increase. We do know there is community spread, but we also anticipated all of this. Our health department has diligently worked on the contact tracing and continues to be on top of, even as the cases have increased, have been on top of all of the contacts that have been made. We also know that there is evolving information that's coming from the state, and so we continue to work, again, as Unified Command with Delta County Health Department, Delta County Memorial Hospital, and the county.
Perfect. Jody, do you want to give us an update on what you are now seeing at the hospital?
So I think the hospital has had very limited admissions. We still to date have only had a couple of ICU patients. We have had no deaths at the hospital from COVID. We have had one transfer out of the area into another hospital for a patient with multiple other concerns besides COVID. And we've still continue to see 1 or 2 patients on the floor, although really a census of 1 or 2 is all we ever have had, knock on wood, at any one time in the hospital. And the mix is both pretty equal between men and women, and really it's been pretty much people over 40 or over that we have seen that are hospitalized, although we know there are younger people who've been hospitalized in other communities. We continue to have regular incident command meetings at our hospital. We continue to meet regularly with the health department and the county and our unified command. And we still have 2 physicians that are working as our liaisons, Dr. Craig and Dr. Knudsen, and they review Dr. Knudsen as a pulmonologist reviews every case that's come through the hospital. We talk about it as a group at the hospital and what our efforts are. We are still limiting visiting at the hospital. We've increased actually our screening at the door. Everyone's having their temperatures taken, including the staff, and excuse me, my mask is slipping, including the staff every day. We question everyone, and the hospital is actually creating a brand new front desk area that we will permanently be able to respond to the needs of people as they come into the hospital and be able to screen or or redirect people to the right department as we move forward. I think it's important to say COVID's not going away. This is something we're going to be living with for a very long time. And I think if you look at SARS, which is related to COVID, which was in 2002, SARS was controlled because they did some of the very things we're doing right now. Granted, that disease did not enter the United States as heavily as this one did, but it was through isolation, through distancing, through all the things that have been tried to be applied to COVID. COVID is different in that people have asymptomatic disease in which they're out in the community and do not know they're sick or have any symptoms. There's a lot more of that. With SARS, people knew they had the illness. It took 2 years to control SARS. 2004, SARS was pretty much controlled through social distancing and the efforts that have been made at the beginning of this illness. We do not expect that with this until there is herd immunity, until there is a vaccine, and even then, we do not know how long immunity will last. SARS immunity is about a year, so if we look at that and study what's happening with that, we could anticipate that maybe immunity is 1 to 2 years long with COVID, and possibly longer, but I don't think we have any idea at this point. So we need to start adjusting our lives permanently, and I think as we look at what we do as a county, as a community, as an individual, we need to think about the fact that this is something you're going to live with. And so we have to figure that into our lives, our day-to-day lives. How are we going to live with COVID? And I think for many of us, we're feeling COVID fatigue at this point. It's been 6 months. I know I certainly have had some COVID fatigue because you're constantly planning for the unknown. And then we don't know, and then that maybe never comes to fruition, which thank God in Delta County it has not. But we are constantly planning. So the hospital is planning now for school beginning. And is there a possibility of an uptick as school begins? We're hoping not. The school's making, I think, big strides in trying to contain this, but we know this is an unpredictable illness, an unpredictable virus, so we can't be sure what's going to happen next. But we are prepared at Delta County Memorial. We've also recruited a pediatrician. Now she's not going to be starting here until January, but that will give us additional support, and possibly we're bringing on a second pediatrician. We're working on that, and that should give us a level of support for all of our children as we move down the road. So I think we are trying to be as proactive as possible, and we appreciate everything people are doing at home to protect themselves, because we're getting a lot of fatigue and getting tired of this illness, but we need to remember it's not going away.
Yeah. You brought up a good point that school is starting. Robbie, do you want to talk a little bit about how the health department has worked with the school district in their planning so that kids can go back to school next week?
So our local health department has been working hand in hand with the Delta County School District to effectively build plans. Now, as all good plans are laid out, they need that ability to modify as conditions change on the ground. We know that as students get back together, as individual faculty get back together, there is an increased risk because you're bringing in outside cohorts to a building. So we do know that there is increased risk for additional spread. But we also know that our school kids have been together during the summer. We know that, just as Jody indicated, that people have started to get together. We know that when we look across all of our recreation sites, people are together. And we still have not seen a significant spike, even though we already know that people are together and they are gathering. But we also know we're going to bring in novel individuals that haven't been together since March, and so there is that increased risk. But that's why our health department has worked hand in hand with the school district to build these plans. But we're going to ask that everyone realize that they're gonna have to be patient, and plans are gonna have to be modified based on individual buildings, based on individual age groups, based on what we learn from other communities that open up in a school district. But we know that our kids need to have that learning that's in place. They need that teacher, they need the structure. And as we look towards the fall, then again, we're looking hard at the mental health side as well. The mental health is so critical. We just got done through with the Delta County Fair, and that was the comment that was made over and over. These kids needed to do something normal, and were allowed to do something normal, and it was just a benefit to their mental health. So we know that school is a critical part of that mental health, and that's why Delta County Memorial Hospital, and Delta County Public Health Department have worked so hard to really get back to, even though we know we're going to have COVID, we've got to learn to live with COVID and have the sense of normalcy to the best that we can. So we're working hard with that, but just understand plans will need to change as we learn more and as each of the students and faculty get back into the buildings.
Mm-hmm. Jody, do you want to talk a little bit about, as we do start school again, and we do potentially see a rise in COVID cases clashing with the flu, the annual flu that comes along, what is the hospital doing different than what you've done in the past 6 months to plan for?
Yeah, so well, first of all, I want to encourage everyone to get their flu shot as well, because we don't want it to be confusing COVID and flu symptoms, although we know they're very similar. So we have made a decision at the hospital that once we have had our first case of flu, or by mid-September, we will be flu testing everyone as well as COVID testing if they come in with symptoms. And so before we would do the flu test, if it was negative, then we'd follow it with a COVID. Now we're going to do a COVID first and follow it with a flu. And so that we know, just like when this started, it was still the tail end of flu season, so we'll be able to know what we're treating. And of course, we're going to be offering vaccines to all of our staff, and the community is going to have an opportunity to get vaccines through their local clinics, through the hospital, the health department, and of course your local pharmacies. And so we would encourage that. And otherwise, the only other thing that we've really done a lot that's different is that we have been our pharmacy's been in touch with FEMA, and we were able to get a few doses of the remdesivir, which is the medication to treat COVID. And there are not a lot of local hospitals that have this medication. St. Mary's, I believe, told us last week they'd given it 19 times. And so we are prepared to be able to use this medication if necessary. And I also wanted to state, we are anticipating that flu swabs, the testing materials may be somewhat limited, even though they overproduced. We expect more tests than normal. So that's why we're not starting flu testing any earlier, because we don't want to run out of flu testing materials in the peak of the season.
Perfect. Well, it sounds like Delta County Emergency Operations Center Unified Command continues to have everything under control as we move into the fall and winter with this COVID pandemic. Is there anything else that you wanted to add before we close today, Robbie?
Well, I wouldn't say we have everything under control, but I would say that we have put the best plans forward, that we have anticipated these increases, that we continue to plan for additional increases, and that we will modify our plans and work together to have that unified approach, to have the best foot forward in regard to an unknown. The unknown will continue to throw curveballs at us, but we will modify our plans and be as prepared as we can be with additional PPE, with additional messaging, with additional support for the hospital and the health department.
Perfect. Well, thank you both for joining me today, and have a good day.